Dr. Dhlomo, let's hope that we can hear you now. Can you hear me clearly?
I can hear you clearly, ma'am, and good morning to you.
Morning. Thanks so much for your time. I was just asking for some clarity on the number of Cuban medical professionals that we have here in the country. Previously, we heard it was 217 or going to be 217. Now we hear it's 187. Just some clarity on that, please.
Yes, thank you very much, ma'am. Yes, the number that we have received also from the Department of Health is 187 specialists of various fields. But you would recall that we already have got a lot of Cuban specialists in the country who came in as early as our democracy that dawned. So I would not be able to know what there's a change of a figure, but maybe that is the number that they ended up giving us, 187 to come in and actually complement our services.
All right, so just looking at the figure that the health minister has given for what it's going to cost us to have them here, we're looking at just over 239 million rand over the next year. We know that these doctors, these experts are expected to be here until April 2021. What are the added costs? Because that, we understand, is just for salaries. What else do we have to add on to that?
I would imagine it is our responsibility as a country to offer them accommodation, and of course from that I think it is going to be in various hospitals and provinces that will take the cost thereof, and I would imagine there probably won't be any cost for travel out of the country, but maybe in between provinces if there's a need.
So ultimately, Dr. Dhlomo, what do you reckon it's going to cost us totally at the end of this, in April 2021? What would we have spent on having the Cuban Medical Brigade here?
It will cost us having saved lives, because we should be comparing Aprils and Aprils. We should not be looking at the cost vis-a-vis. The right question is to say, what would have happened if our country we did not invite the Cubans to come and save our situation? These are world experts. There's no country in the world. Look at that. There are countries in Italy, in UK, everywhere in the world, because there's no country in the world that can actually talk of medical specialists that actually understand the pandemics of outbreaks better than Cuba. Their public health training is the one that actually assists the whole world. And I mean, these are first world countries, but they actually are actually failing to manage COVID-19, and they rely on the service. So I would say the cost should not be compared to the saving of lives. What it cost us is the lives that they would have come in to save, because these are specialists who we don't have in the country, probably are scarce, and they're in private sector: epidemiologists, virologists, immunologists, biostatisticians, family physicians. We don't have the abundance of those. Some of them who are here in the country are in private practice.
All right, and I do understand, yes, and you know, the debate goes on as to what value they actually add to the country, and there's many schools of thought out there. We try to remain objective about it, but I'm sure many South Africans would like to know what ultimately would be. Are we looking at something like over 400 million, which is the figure we've seen bandied about over the past couple of weeks, that ultimately that's what it's going to cost us?
Yeah, no, the parliamentary question that actually was asked by the DA, which I'm now responding to, was just the cost of salaries. Like I'm saying, there's not been any quantity to say if you then find that you need this biostatistician to move from Gauteng now to Western Cape, those internal logistics, and actually what is it to cost to put them in a room or in a house in Constantia vis-a-vis putting them in a house in Ikopo. That part has not quantified, but yes, probably it will be more than the salaries that they have.
And as we know, they are expected to be here until April next year. Is there a cap on the amount that we are going to be spending on having the Cuban doctors here?
Yeah, no, I don't think we're having a right debate. I'm saying the point of my departure is what would have happened if we did not have them here. We would be having deaths as much as we have in New York, and deaths as much as we are having all over the world. Why are we not quantifying that part vis-a-vis? Because money can always be there, but lives can go on and we never get them again. You know, this is what is a fundamental problem here. That is the reason why in our democracy, President Fidel Castro and President Nelson Mandela created this program championed by Dr. Nkosazana Dlamini Zuma. When they realized that we do not have enough, they said, look, we'll bring your students in Cuba and train, but meanwhile, we'll send a couple of our doctors to come to your country. Now, nobody's asking how much does it cost to have the Cuban doctors who have been here from about as early as of our democracy. They must compare even that part with the life that they've saved by being here in our country since that time.
And on that note, Dr. Dhlomo, they've been here for well over a month now, having arrived in April. Has it been worth it? Have we seen the results of having the Cuban Medical Brigade here in South Africa?
Look, it's not like you've brought in some people that you must put in a plantation of a sugar cane and they see them chopping the sugar there, see it now. But their presence and their support, you realize in the long term. But already, I am not a clinician at work currently, but I have been to the Eastern Cape last week on an oversight visit, and I saw some of them. I had the responses of some of the doctors. Some were saying, this public health training that I received in Cuba, and these doctors, by coming here again, are going to augment my very same training. So here and there, we don't have a quantified report. I mean, they've been here for a month, but you realize that the first 2 weeks, they will actually have to be quarantined and get the soda. So they've officially been out in the field for the past 2 weeks. Now, you can't quantify already their outcomes and their impact within 2 weeks that they've just been in our clinical wards and hospitals.
But is there a plan? Is there a way that we will, in the next couple of months, be able to see whether this has been worth our while?
That is my point of departure, is that we have, besides these 187 Cuban trained doctors, Cuban doctors who are here in the country, we already have over 100 of those who have been in our country for the past 20 years. We have seen and actually received a wonderful expertise, knowledge from them, and we have seen the impact. These ones I see as coming in to add on to already that existing public health approach that was brought into our country by Cuba. We do not have the way, these specialists are coming in to actually tell you, don't admit patients in the ICU because of COVID-19. This is the way to go. Go to the community and start programs this way. That is actually a public health knowledge that is coming in with these specialists. Nowhere in the world have we seen them actually failing in dealing this with. So they are world experts in actually supporting countries on pandemics like the one that we have in our country and in the world.
Thanks very much for that. Chairperson of the Health Portfolio Committee, Dr. Sibongiseni Dhlomo, just explaining to us the cost of having the Cuban Medical Brigade, as they've come to be known in the country. But you can understand, yes, it is early days. Time will tell if it is money well spent.